Hello, good evening. It's Tuesday night, and this is me. We're going to do some questions, or you're going to do. Well, you've done some questions, and there are some. And if you've got any questions, then please feel free to add them, and I will do some answers. Jonathan Staiano, plastic surgeon, speaking, as it says down here. And what we're doing tonight is a Facebook Live Q&A every Tuesday, 7 p.m, which is what it is now. It is Tuesday, isn't it? Yeah. So please comment and share, and feel free to ask any questions if there are any. I have got some questions already, and it's always fantastic to get questions sent by email or Facebook Messenger or whatever. So I do welcome the questions. So thank you very much for continuing to ask questions. I'm very grateful for you, to you for that. So here we go. That's the Doge. Hey, I was advised to get in touch with a couple of questions about surgery. Due to complications during a birth, I had complex surgery and stay in NICU. That's neonatal ICU, is it? This brought to light that I am not able to undergo general. I had issues with oxygen levels and developed pulmonary hypertension. I've lost over 5 stone in the past 24 months, and this combined with multiple pregnancies have left me with sagging stomach and deflated breasts. I'm trying to get information on whether a mini tuck and breast implant uplift, potentially with transfer of fat from stomach to breast, is possible under local. Also typical how much size loss there is when doing an uplift. I am 34F/G. Right. A few issues there. Okay. So first issue, I've got to try and remember about. I should have done this as 2 separate questions about the size loss when there's an uplift. I've got to try and remember to answer that. But I'll do the first one about whether a mini tummy tuck and breast uplift with transfer of fat to the stomach. There's another question in a minute about mini tummy tucks, and I've just as a thing, if you've lost 5 stone, I think maybe a mini tummy tuck won't be enough. Just put that out there. But in fact, the other question talks about, but maybe it's the same person asking a question anyway, because there's another question about mini tummy tuck under local. Anyway, so the bottom line is, the specific answer is, if you're specifically saying, can a mini tummy tuck and a breast uplift be done under local? Yes, they can. Personally, I wouldn't want to do them both together under local. It's perfectly reasonable to do them both together, but I think to do them under local, both of them under local, is a bit too much. But you certainly have them done separately under local. They're both relatively big operations to be doing under local. They're sort of pushing the boundaries of what you can do under local, but it is possible. And again, if you add in a fat transfer from the stomach to the breasts, you're adding in even more surgery. So I think it is a lot to be done under local anaesthetic, but you'd probably have to stage it, and I don't think you'd be able to do both under local. And I actually think a breast lift with fat grafting from the stomach to the breasts in one operation under local, personally, I think is pushing it a bit. It'll be local and sedation, not pure local. That's the question specifically asked. The other thing that would worry me a bit is, what I would suggest is, whoever you see, who are your plastic surgeon, I think they're probably going to want to talk to the surgeons or the doctors who are looking after you, who have told you that you shouldn't have a general. Because you've written here, due to complications, I had complex surgery. I'm not able to undergo a general. I had issues with oxygen levels and developed pulmonary hypertension. If you have got an illness, so personally, I'll be asking you, how ill are you? Have you got a good exercise tolerance? Are you able to, walk up the flight of stairs? Are you able to sort of live a normal life? Because if you are, then that will be okay. But if you've got problems with pulmonary hypertension, if you're not really able to function in life normally, and you are at risk of it having a general anaesthetic, I think you're going to have risk of having a local anaesthetic with sedation as well. So I think you've got to question whether it's worth having surgery at all if you are, unwell and not well enough to undergo a general anaesthetic, because the stress associated with the general anaesthetic is similar to that associated with local sedation, because local sedation is you are sedated, it is quite an invasive thing, and these are quite invasive operations, so they'd be quite taxing to your body and to your respiratory system and what have you. So I would question whether you would be a candidate for surgery at all. So on paper, a mini tummy tuck and breast lift can be done under local and sedation, but if you've got a pre-existing illness, which means you can't have a general, it may also mean that you can't have a local sedation, because it's still quite a stressful thing to undergo. So we'd have to talk to your doctors, and we'd have to think about whether it would be worth um, doing something less or not having surgery, really, if you're very debilitated by your pulmonary hypertension, because you're going to have risks with local sedation. Um, so that is an issue. Now, the other thing I mustn't forget is how much size loss there is when doing an uplift. I'm a 34F/G, so it varies that, and I haven't got a good answer to give to people when they talk about the size and an uplift. I normally say it's about the same. Some people say that they feel bigger because the breasts are higher up on your chest. Some people say they feel smaller because you do remove a bit of skin when you do an uplift, but the volume that you remove is very small. Broadly speaking, I think it's about the same. But what I would say, if you're a 34F/G, that's quite a big volume of breast. And if you do an uplift on someone who's got a big volume of breast, that volume of breast is going to be acted on by gravity and can sag again. So I don't know what you've got to have the size you want, and if you want to be that size, fine. But it's an idea to think about having a reduction, maybe taking some volume out of the lower pole of the breast to try and reduce the heaviness of the breast, so it's less likely to sag again. Because if you do an uplift on someone who's a 34F/G, yes, you will make them lifted to start off with, but they will settle / sag, and the bigger they are, the more they sag. Oh, hold on a minute. Oh God, I've missed the comments. Oh God. Emma, hi Emma. Jade, oh God, I've neglected Jade. Good evening. Jackie Moore, this is your guy. He's ace. That's it. Thank you, Emma, for that vote of confidence. Claire, I had breast implants done by myself that is, 5 years old. 5 years old. Okay. Good, Claire. Hope all's well. I hope it's all going well. Long time no see. By all means, come and say hello at any time. You know that. Joy, hello. Holly, evening. Yan, hi. Oh, here we go. The second plot. Oh, I keep getting a few air bubbles in my left breast. Is this normal? Claire, 5 years old? Not really, no. 5 years. Very initially, yes, that is normal, but a bit abnormal 5 years on, Claire. It doesn't sound like a worrying thing, so I'm not particularly worried about it. But it doesn't. I wouldn't say it's a normal thing. 5 years post-op. So anything like that, any niggles or anything you worry about, why don't you come back to the clinic, and I'll see you and see what's what. Just but as I say, it doesn't sound like anything to worry about. But I wouldn't particularly say it's anything that's normal. So yeah, come and have a look. It's probably nothing. Joy says, "Am I the only person who can't see anything?" I hope you are, Joy. Yes. Can people see? Can people see me? Can you see me? So I think the camera's working. I think got a little light and all that. All more cons. So yeah. So yeah, Claire, come to the clinic. Here we go. Supplements. Is that going on? Yeah. I take supplements. Oh, it's okay. Very fuzzy. Oh God, don't tell me the internet's gone funny. Is the internet funny? Is the movement all fuzzy? Yeah, it is, isn't it? Oh, it's the internet, isn't it? Let's do internet speed test. That's what I need to do. Sorry. All right. I'll tell you what, I shouldn't do it on this one because I can't see a thing. No, I will do it on this one. Can you internet speed test? Right. I'm running on speed test. Right. You know what? I bet it's the kids. I should tell the kids to get off whatever they're doing. They're probably doing all stuff on the internet. They don't realise how important this work their dad's doing in the in the other part of the house. Got no respect. I'm gonna. It's okay now, is it? It's a bit pixelated, but can hear you fine. Sorry, guys. I think it's my children. They are out playing on their games and stuff. Should I go and tell them? No, I can't do it in the middle. I can't do it mid broadcast. I'm a professional. I'm going to push on. I'm pushing on. Supplements, if it's really bad, say, and I'll go and have a word, exert my authority. I take supplements, vitamin C, biotin, lysine, and cod liver oil. Do I need to stop prior to surgery? Brackets, breast reduction. Right, what I need to do here for this question is this. I need to do this. Disclaimer. So this is, it is pixelated, isn't it? Oh, God. This is my personal opinion, and I don't think I don't know. I don't think this is my patient here. So the answer to this question is check with your surgeon, because your surgeons do have views about this stuff. And what you'll find is a lot of this stuff is based on people's opinions and surgeons' opinions and experiences. And some surgeons do have opinions about supplements, um, and will worry about certain supplements, because some supplements can increase bleeding and what have you. So they worry away. They won't let you take certain supplements. So you better check with your surgeon first. For me, I'm okay with them all. I'm okay with vitamin C, biotin, lysine, and cod liver oil, and I'm very happy for you to take those. And I don't see a problem in it. But check with your surgeon first. But certainly, I've got no problem with you taking those supplements. But to be honest with you, the surgeon will probably be grateful to you for asking the question. Um, I would be grateful for people asking the question, because it is sometimes people are on funny things you worry about, and some surgeons do have strong views about it. So don't be not ashamed, don't be afraid to ask your surgeon. But if it's up to me, I'm okay with supplements. Now, this is the one that might have been the same person as early on, but I'm sure no one's really keeping track. Oh, Joy says it's not just my kids' card. No, Joy, got no control whatsoever, to be honest with you, which is why it's probably just as well I don't go and try and do it now, because I'll just humiliate myself by being told to, you know, get on with it by my children. So they don't realise what's going on here. They've got no idea how famous their father is, and you know the reach of my social media footprint. But one day they'll look back and they'll realise. Um, hey ho. So yeah, I got a feeling this might be the same person as earlier, because it's a pretty similar question, isn't it? Anyway, we'll just pretend it isn't, and we'll pretend it's a new question. Is it possible to have a mini tummy tuck under local? Let me think. Yeah, it is. Yeah, certainly a mini tummy tuck under local is possible, and it's still quite a big deal to have under local. And the thing about having things under local, what I normally do is I normally talk to people about um, the fact that if you want a local, people have got to be up for it, have got to be up for the local. The patient has got to be sort of keen to have it. I wouldn't really try and push a local anesthetic on someone for a bigger operation. Now, when we talk about local, it means local and sedation. It's not pure local. You're not purely awake like you are now. You're sedated. But I wouldn't push local and sedation on someone, because you can often feel things. You can often get twinges and things. All that's a bit sore, and have to put a bit more local in. So the patient has to be on board with the whole thing. Is the first thing to say. But if the patient's on board, a mini tummy tuck is possible under local. Next part of the question is, what's the difference between a mini and a full? Now, a full tummy tuck is possible under local. Again, full tummy tuck is probably pushing the boundaries even more, but it is possible under local. Again, with a patient that is committed and is happy to have it. We normally do these things in a hospital where we can do a general anesthetic. So we say to patients, look, if it's uncomfortable, if it hurts or whatever, if you're not enjoying it, we can always convert you to a general anesthetic. The difference in a mini and a full is there is a lot of move, obviously, well, not obviously, well, yeah, obviously, to have less scarring. Breast lifts, face lifts, tummy tucks, they're all sort of tightening the skin. They're all doing the same thing. And everyone wants a short scar facelift and a short scar breast lift and all this sort of stuff. And same with the tummy tuck. So a mini tummy tuck is a shorter scar, but anytime shorter scar, less skin is removed. So it's a shorter scar, and it's only really suitable for people who've got a little bulge above the pubic bone. Above, if you've got a cesarean scar, a little bulge is really pixelated, isn't it? Little bulge above the that's really pixelated. Pubic bone. because it only takes a bit of skin between the where your cesarean scar would be, or your sort of top of your pubic hair and your belly button. You take a section of that skin away and tighten the skin in that area. So you tighten the skin from the belly button to the top of the pubic hair. You don't do anything to the belly button. So sometimes the belly button gets pulled down a bit. You don't. There's no scars on the abdomen itself. There's no scar around the belly button. So a full tummy tuck is a much longer scar than a mini tummy tuck. It goes from hip to hip. It's the same place as a mini tummy tuck, which is about the place of a cesarean. So a mini tummy tuck is a bit longer than a cesarean scar. A full tummy tuck goes from hip to hip, but there's also a scar around the belly button because all of the skin from your belly button down to your pubic hair or down to where your cesarean scar is removed. All that skin is removed. So you're not just tightening that skin, you're removing it all. So if you've got any moles, if you've got any scars, you've got any, tattoos or anything in that area, they all go. And then we cut out the belly button, pull that skin down, and then pop the belly button back out in a bit of skin that used to be in above the belly button. So we relocate the belly button with a full tummy tuck. So a full tummy tuck, by and large, a bigger operation. Because we're going above the belly button with a full tummy tuck, we can repair the muscles as well. The rectus muscles, the recti muscles, the six-pack muscles. Sometimes they're splayed apart a little bit. If you've had children or if you've lost weight, they become weak, and there's what we call divarification of the recti. It's a little splaying of those recti muscles, and we can bring them back together with a full tummy tuck. You can't really do it for a mini tummy tuck because you can't really get above the belly button because the belly button's stuck in place. Whereas with a full, you sort of cut the belly button out and you can get higher up. So yeah, the main difference is there's an extra scar around the belly button. The scar on the abdomen is longer, and you can repair the muscles and bring them together with a full tummy tuck. And also a full tummy tuck contours the whole abdomen a bit better, the whole sort of width of the abdomen, whereas a mini tummy tuck just concentrates that bit above the pubic area. Oh God, I've neglected the. You're doing great. Oh, thank you, Joy. You're doing great. Don't worry. That's sweet. Thank you, Joy. Sorry about the pixelation. Helen's got a question. What is the difference between textured and polyurethane? So textured implants, I've got them here. So textured implants are silicone implants with a rough surface. And basically, what happened was when they first made silicone implants, they were smooth. They had a smooth surface, and they discovered that they would go hard. They would develop capsular contracture. They'd have hard scar tissue forming around that smooth surface and forming a hard capsule around the implant and making them feel uncomfortable and require them to be changed. So then they developed polyurethane foam implants. And polyurethane foam implants have got a foam coating around the outside. And what they found was the scar tissue, rather than just going around the implant, would grow into the foam in a three-dimensional way, so that when it contracted, because it's still contracted, it didn't contract as a sort of sheet around the implant. It contracted in all different directions. So the risk of capsular contracture, or the rate of hardening of the implant, was a lot less with polyurethane implants. Then they did this thing where they found that they cause cancer in rats. So they said, good God, we just can't use these implants. So they stopped using those implants for a while. And what they did in that time is when they got the wet silicone, they imprinted, well, not all of them, but there's different ways of doing it. But one of the companies, Mentor, the way they make the texturing of the implant is they get a wet silicone implant and they imprint polyurethane foam on it in order to get the texturing. And the texturing is trying to mimic polyurethane foam. It's trying to make the surface of the implant a bit rough, so that it's less likely to have capsular contracture. So it's less likely to have capsular contracture with a textured implant compared to a smooth implant, but it's not quite as good as a polyurethane implant, because a polyurethane implant's actually got foam coating, so it's a three-dimensional foam, so the scar tissue goes into foam rather than just slightly roughened texturing on the implant surface. So they're both silicone implants inside, but a textured implant is just slightly roughened silicone, whereas a polyurethane foam implant has got this polyurethane foam around the outside. So I hope that's. Here we go. Oh, Helen, what's the difference between en bloc and capsulectomy, and which would you need when removing 2 urine polyurethane implants? Thank you. Helen, I know you haven't asked this question. Someone else has asked that question later on, but I am going to answer it now. Here's what's the en bloc removal of breast implants. Do you do en bloc removal? And so here's my question from later on. Do you do en bloc removal, and how many of this type of operation have you done personally? So similar question, Helen, and this one. So what's the difference between en bloc capsulectomy and which would you need? Oh, sorry, en bloc and capsulectomy. Okay, right. Well, capsulectomy is removing the capsule. So en bloc just means removing the capsule with the implant inside in one piece. So it's not a difference in en bloc. So you can do a capsulectomy. You can either remove the implant and then take the capsule out. That's a capsulectomy. Or you can do an en bloc capsulectomy where you take the implant out with the capsule still around it. So you take it out intact. It doesn't matter. I get a lot of people talking about en bloc removal of implants. And it's actually quite hard to do an en bloc removal of breast implants. So the other patient who's asking me how many I've personally done en bloc removal, I don't do it very often. And the only times I do it is if it's easy. I don't actually make a big deal of trying to remove an implant with a capsule in en bloc. What I normally do is I do an en bloc excision of the capsule. So you've got a capsule, hard capsule, because it's usually a lot easier to leave the implant in while you're doing the capsulectomy. But just at the end, if it's really hard, that implant, it's actually quite hard to get it out of the incision. You normally got about a 5 centimeter incision. So if you've got a big hard implant, it's actually quite hard to get it out. And you might have to extend the incision if you wanted to get it out intact en bloc. So what I would do at the end, I would take most of the capsule while it's still attached. At the end, I would just take the implant out, and then suddenly that capsule would sort of deflate, and then you can get it out a lot easier through the incision. So that's what I normally do rather than specifically. The only good thing about taking it out en bloc, to be honest with you, full disclosure, the only times you do it is, as I say, when it's easy. And the good thing about it is it does make good photos. It is good to have a photo of an en bloc implant with a capsule in, and you can cut open the capsule and then show how much bigger the implant is than the capsule to show how over time it's contracted. So personally, and then as I say, it's just my opinion. I don't really go hell for leather and try and do en bloc. I do en bloc for most of it, but then I don't complete it en bloc. I normally just take the implant out at the end because it's a hell of a lot easier to take the implant out separately because the implant's nice and soft, comes out through the 5 centimeter incision quite easily, and then that deflates the capsule, so then it's easier to take out. So when removing 2-year-old polyurethane implants, you wouldn't need either, Helen, unless you're having new implants put in again. If you're not having new implants put in again, you don't need any sort of capsulectomy, or unless the capsule's really hard. So if the capsule's really hard, then you could. But you don't necessarily need a capsulectomy if you're having just removal of implants and not replacement. If you're having replacement, then you could think about, well, yeah, you don't need a capsulectomy if you just remove the implant, unless the capsule's really hard. If you're having replacement, then again, if the capsule's really hard, you probably do want to remove that capsule because you don't want to put another set of implants in with a hard capsule around the outside. But if the capsule's soft and you're putting the implants back in, if you're putting silicone implants back in, then you could just put them straight back in. If the capsule's soft, maybe just do some work on the capsule scoring and things. But if you are going polyurethane, because you want the scar tissue to grow into it, you usually need to do a capsulectomy when you're putting polyurethane implants in to allow the scar tissue to grow into the capsule. Can you have liposuction under local? Yes, you can, Emma. I don't do it much because I find it's quite traumatic and it's not very comfortable. So it's only really for a small area of liposuction. There are some types of liposuction like VASA and, well, I guess VASA is the big one, which is sort of like an ultrasound assisted liposuction. And that's a bit less traumatic because the ultrasound sort of breaks up the fat before you suck it out. And they tend to do that much more under local than traditional power assisted liposuction. I don't do that, and we don't do it in our clinic, VASA, but that's something you might consider if you did specifically want liposuction under local. You could have power assisted liposuction under local, but I think it's a bit uncomfortable, and I think it's usually better to have a GA. But if you're really keen to have it under local, it's absolutely fine. It's just the movement's a bit unnerving, I find, for a patient. But again, it's your body, so if that's what you think you'd like, then that would be something you could consider. Jade, with a breast oh, sorry, Emma. God, I can't keep track. It's for a small area. Okay, well, maybe it would be okay then, Emma, to have a bit of lipo under local. Yeah. Jade, with a breast uplift and implants, is nipple reduction or reducing of areola size included in the surgery, or is it an extra? Yeah, a lot of people get a bit, ask for a lift and areola reduction. Now, two things there, Jade: the nipple and the areola. Don't want to be semantic. But just to make it clear, the nipple is the bit in the middle that sticks out. The areola is the pigmented bit around the outside. So we don't do anything to the nipple when you do a breast uplift, although sometimes actually the nipple can be a bit pulled in. But don't make the nipple smaller or anything like that. And also don't tend to correct something like an inverted nipple when you do a mastopexy. So don't do anything to the nipple. But reducing of the areola is an integral part of a breast uplift or a breast reduction. So you've written there breast uplift and implants. If you're just having implants, then no, it's an areola reduction is an added extra. But if you're doing a breast uplift or a breast reduction, you have to cut around that areola to lift the areola, because that's part of a lift or a reduction. You're lifting the areola, and so you can decide how big you want to cut around that areola. You remove all the skin around it. So a breast uplift and an areola reduction is integral part. You don't have to pay extra, same price and what have you. It's it's all part of it, part and parcel. So where are we up to? Here we go. Question, well, 4 of this list. Do I need to stop e-cigs? Do I have to stop e-cig prior to surgery? How long before? Or can I just use a really low cig? Sorry, been driving around a lot today. What's a really low cig? I don't know what a low cig is. Anyway, ideally, yes. Now, e-cigs are better than cigarettes, but they're not brilliant because they've often got nicotine in them. If they haven't got nicotine in them, they're just steam. If they're just steam, then that's fine. But if they've got nicotine in them, then you should stop them. And I know there's different levels of nicotine. Now, it depends on the surgery you're having. If you're having something like if you're having a mole removal or minor surgery, or even something like breast implants. Now, something like breast implants, this is just a 5 centimeter incision. It's not normally a big thing. So healing's not normally a big issue. Having said that, if you get bad healing with the breast implants and the implants gets infected, and there are bad things that can happen. So you want to maximize your chances of healing, because cigarettes reduce the risk of healing, or reduce the rate of healing, I should say. So breast implants, I'm not strict on, but if you're having some kind of skin tightening procedure like a mastopexy, a tummy tuck, facelift, something like that, I don't do facelifts, but anyway, those sorts of surgery, I would say do not have it if you are smoking, because smoking reduces the blood supply to the skin. These wounds are all under tension. If the wound's under tension and it doesn't heal up, it goes ping, 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 and it really opens up, and it can be really bad. So as I say, it depends on the surgery. So if it's something like a mastopexy, tummy tuck, or something like that, I would say yes, you do need to stop smoking. How very dare you? Do I have to stop smoking? How long before? Ideally, 6 weeks before. Ideally. So if you're having a tummy tuck or something, ideally 6 weeks before. That's the ideal. But that, you might say, forget it. That's never going to happen. The less than ideal, again, this is up to your surgeon. This is my sort of regime. The less than ideal time is the time you have the surgery to 6 weeks after. Sorry, to 2 weeks. Oh God, the time you have the surgery to 2 weeks after. Sorry. So just to recap, 6 weeks before ideally. If you can't stop 6 weeks before, the really crucial time is from the day of surgery to 2 weeks after. That's the healing time. You have to get these wounds healed. Once the wounds are healed, obviously you should stop smoking for your health, but less of an issue. So get your wounds healed. Those 2 weeks are crucial. Point of the day of surgery, 2 weeks after. I know what you're going to say. I'm stressed. Oh, it's all sore and it's all this, and I've got nothing to do and all that. You will be even more stressed if your wound breaks down. So don't smoke for those 2 weeks. Absolutely essential, I would say. But that's my view if you're having one of those sorts of surgery. So, God, missed a whole load. Added extra, got that one. It's for a small area. Are we keeping you up? Sorry. Oh, God, that's a bad comment. Sorry. Come on, put yourself together. Sorry about that. I didn't know that. Brain's not working tonight. You didn't know about the lift? Oh, that's good. I've taught you something. There you go, Jade. I've taught you something tonight about the lift and the area reduction. Is it? I think. Chantel, new entry at number 10. New entry. Chantel, can a lift still give quite feminine, stroke firm results? I've got very little tissue, but I've been advised that a lift would be enough to restore shape, but I can't see how that's possible without implants. Great question, Chantel. Great question. And I think you're right. I mean, yeah, it's tough when you haven't got much volume. That's all you've got, and that's all we've got to work with, and that's all you'll have. So whatever cup size you are now, as I say, you're going to be about the same. First of all, a lift can't. You have to be realistic about what your goals will be with a lift, because it's never that sort of tight and tense. It is when you first have it done, but it often, especially if you had children or something, if your breasts are drooped because of children or weight loss and the skin has been stretched, it never keeps that tight look. Now you might think that's good or bad. Sometimes when you first have it done like that, some people say that's great, but some people say, oh my god, it's awful. Whatever happens, it does settle with a lift. That's the first thing to say. But absolutely, if you haven't got much volume, that's all we've got to work with. So if you want more volume, and certainly if you want more fullness in the upper part, that's when implants come in. So implants could be done to give more volume and more fullness, but there are risks with having implants, and a lift with implants is a big op. So it's not something to be taken lightly. So I think there's a lot to be said for just having the lift and see how you go, and then have implants at a later date if needed. But again, it's about being realistic about what you can achieve. And if you think, look, I'm definitely not going to be happy with just a lift, then you might want to consider lift implants in that same op, but it is a big op. So I think I would share your concerns. By the way, I have invited Kurum tonight, but I don't know, he doesn't answer me. You guys are all having a problem with your Beeline. Do you want me to put the link in? Add guest link. You have to download some Beeline thing, don't you? If someone didn't want implants, how many cup sizes can you gain from grafting to the breast instead of, and do you do it? Thanks again. Hi, Helen. Thank you, Helen. I was just looking at one of your Facebook posts just now, and oh God, I couldn't stop laughing. Couldn't stop crying with laughter in your thing. So back to the question. Oh no, I've got Chantel's question up. So good question. For me, yes, I do it. I do fat grafting to the breast, but I always say to people, it's subtle. And broadly speaking, a cup size is about 150 cc's. Now, it depends on the body and it depends on how much you've got for donor sites and what have you. But when you're doing fat grafting to the breast, particularly if you're doing to both breasts, for me, and this is just for me, full disclosure or disclaimer or whatever, for me, a big fat graft for me would be like 50, 60 cc's, and 150 cc's is a cup size. So far less than a cup size. So you're saying, how many cup sizes can you gain from fat grafting? If I'm doing it, not even a cup size, Helen, you're looking at 2 or 3 sessions to get 1 cup size increase. So that is the main limitation of the procedure in my hands. And so it is a subtle increase. It's good for localized volumes. It's good if there's one breast, a bit smaller than the other or something like that. But if you're having to split the fat graft between them both, it is limited what you can do. So that is the problem with fat grafting. On paper, fat grafting sounds great. No one wants implants, all this stuff about implants and all the terrible things in the news about them. No one wants them. But if you want a predictable increase in volume, they are the best way to do it, in my view. And fat grafting just isn't quite there yet, unfortunately, because it is great on paper. For Chantel, so basically after huge weight loss and multiple children, I've been left with a lot of loose skin in places. Tummy tuck first. Thumbs up. Yeah, I reckon so. Chantel, sounds good. Go for the tummy tuck and then see how you go in terms of your breast. And talk about it's just about having a conversation with the surgeon about whether you have a lift or a lift with implants. Helen, if someone didn't want breast implant, oh Helen, that's what we like. Double comments, get the figures up, get the numbers up. Good. Chantel, thank you for asking. Sissy says hello back to you, Sissy. Nice to see you. I am cracking on here tonight, Sissy. And how are we getting on? So we've got the e-cigs one, we've done that. How much lipo we got, and we've got the scar revision one. So look, this is good, isn't it? It's good, isn't it? Huh? How much lipo can I have in one go? So how many areas of lipo can be done at the same time? I'd like tummy, back, bra fat, thighs, and arms. And if they can't be done at once, what order would you recommend? So the two things about this are, medical side of things, and then the sort of physical, I suppose, side of things. So medically, you've got to be a bit careful about how much you can do lipo in one go. If you do lots of lipo, if you do huge volumes of liposuction, like several liters of liposuction, you get fluid shifts afterwards. So fluid goes from the, well, anyway, don't worry about it. But basically, you feel weak and wobbly because you get fluid fluid shifts in your body, and your blood pressure can drop, you can feel dizzy, you can faint, you can fall over. So if you're going to have several liters of liposuction, you're probably best being admitted overnight, having a drip up, just keeping a monitor on your observations. So for that, in those terms, from a medical point of view, are limited as to what as to the volume. And so you're looking, several liters, certainly like 3, 4, 5 liters of liposuction. That's big, so you've got to be thinking, admission and being a bit careful overnight stay. But I suppose the question is actually how many areas of lipo can be done. So that's really more about the physical aspect of it. And the physical aspect comes in two forms. First of all, from you've got to think about it yourself. If you're having your tummy, your back, your bra fat, your thighs, your arms, flipping neck, it's all going to be bruised, swollen, tender. You're going to be, struggling to recover post-op. So you've got to think about the post-op recovery. But also you've got to be thinking about the positioning in theatre, or at least that's what I'd be thinking about, because assuming you have this done asleep, if you're awake, it might be different because you could sort of move around. But if you're awake, you'd probably be sedated, so you wouldn't be able to move that much. But it's quite hard to do the tummy and the back, and the bra fat is also quite far around the back. So thighs and arms. So for me, I think that's too much, all that in one go. I would say something like tummy and thighs would be good, and then maybe back, bra fat, and arms would be the two ops. I do it in two goes, and the back again. We'd probably have to still do some kind of thing. Like we'd have to probably do 2 turns, or maybe back, bra, fat, and arms. Could we do that with you? Prone, maybe, but we'd have to think about position. But yeah, I think tummy and thighs would be reasonable, and I think back, bra, fat, and arms would be reasonable. So I would probably stage it like that personally. What's going on here? Elaine says hello. Hello, Elaine, and that's a clap, is it, or a wave? Anyway, back at you. Jan, HHA, what procedures do you like doing the most? God, this is now we've got into the realms now of stuff like Piers Morgan life story says now, isn't it? This is what we want. This is the sort of that's the sort of question that's another level, that is. It's really weird, Jan. I love doing liposuction, but I don't do it very often. It's weird, that, isn't it? I love doing liposuction. It's so satisfying. Small incisions, seeing the fat come out. I love it. So I do really like doing liposuction. I do like doing tummy tucks. I like doing tummy tucks recently. I mainly do breast, obviously, and breast implants are great because you do get an instant, result. And when you, get that volume, the proportion just right, it is great. But surgically, yeah, tummy tucks, I do like. Basically, I only do the stuff that I like, Jan. So that's why I just do sort of tummies and breast. That's all I really do. So yeah. But I guess I'd say tummy tuck if I'd say one. Although anyway, yeah, let's not overthink it, guys. Kim, I'm having a TT and a breast lift with implants, and I feel like I've hit by a bus, lol. And what painkillers will I be getting to help? Yeah, sorry. Am I going to feel like I've been hit by a bus? Probably, yeah. I mean, a tummy tuck in the breast, it's quite a big thing, but it's perfectly reasonable to do, Kim. I wouldn't worry about it too much. It's perfectly reasonable to do in one go. Tummy tuck and the breast lift. Probably the tummy tuck is going to be more of an uncomfortable thing than the breast lift. The breast lift is going to feel tight. The tummy tuck obviously feels tight as well, but sometimes you have to repair the muscles, and that can be a bit uncomfortable, especially when you cough and stuff like that. So you are, yeah, I mean, maybe not hit by a bus, but you are going to feel knocked back, shall we say. For me, what I do when you're in pain with a tummy tuck, I always sort of bend you more. You'll be bent. You'll be bent up. Your legs, you'll be flexed to the hips. So you'll be sitting forward, and you probably have some pillows under your knees. So it's often good to sort of sit up more, just to take the tension off your tummy, rather than going too strong on the painkillers. I always say to people, and again, this is up to your surgeon, but I always say to people to be careful with the painkillers because they can make you feel constipated, they make you feel sick, they can make you feel dizzy. So they've got all sorts of side effects. So I go with ibuprofen and paracetamol. Keep it simple. I usually go with normal painkillers. But if you're in pain, obviously you'll be in hospital probably for a day or two afterwards. So then they'll have access to stronger painkillers like codeine, morphine, obviously sort of opiate type painkillers, which are very good painkillers. But as I said, they do have side effects. So I always say to people, just be a bit careful with those painkillers. And if you're not in that much pain, don't take them. A lot of the discomfort is relieved by taking the tension off the wound. So when you're walking, you'll be bent forward for the first week or so. But yeah, I wouldn't over egg it, Kim. I don't think you'll be that. Hopefully, you won't be that bad. But you know, you will be a bit uncomfortable because it's quite a lot of surgery. But that sounds great. That'll be really good. Good luck with that. Mims Tree Living. Can you recommend anything to reduce appearance of brachioplasty scars 1 year post-op? 1 year is quite a long time, Mims. The main thing about scars, any sorts of scars, massage, time is normally the main thing, but a year is quite a long time. But still, it can take 18 months, 2 years for things to properly settle. If they're a bit red, sometimes laser can help, especially if it's a year post-op, so you've given it time to mature. And then it depends on what the problem is. I'm assuming it's redness. If they're a bit thick and lumpy, sometimes steroid injections or silicone dressings can help if that's the problem. If they're a bit stretched, then you could consider revising them if they're sort of wide. But if they're sort of flat and just red, then it's just massage, stay out of the sun while they're still red, and just persevere with it, and maybe laser if they're annoying you and taking a long time to settle. But I think if it's just flatness and they're red, give it still time, although it's been a year. But Jan says, cool, thanks. I was just being nosy. Jan, I like it. It's a celebrity question. Joy says, JJ, what's the recovery time? Oh God, what was the question? Recovery time. What's the recovery time? Let's have a look. Doing great. Glad it's just not my kids. What was your question, Joy? Am I the only person who can't see anything? What's the recovery time for what? Joy, what's the recovery? Oh, here we go. Oh, sorry. Next question. Sorry. JJ, what's the recovery time if you have TT and breast reduction and lift at the same time? Right. Breast reduction and lift, same operation. So in that question, we can scrub lift straight off. That's just a TT and a breast reduction. So a lot of people think, I want a breast reduction and a lift. A lift is an integral part of a breast reduction. So again, big operations. Breast reduction is a big operation. Tummy tuck is a big operation. Well, assuming all heals well, because they're both closed under tension, there's always potential problems with wound healing at the T-junction of the breast reduction, or sort of centrally or around the belly button with the tummy tuck. But assuming all heals well, I would say probably the tummy tuck is going to be the one that's going to sort of knock you back a bit more. So in my practice, you'd have dressings on for a week, then you don't normally need dressings on after that. You will feel a bit fragile and a bit uncomfortable after that week, so probably 2 or 3 weeks, probably 3 weeks, I'm going to say, before you're doing driving and things like that. You're pottering around the house for the first 2 or 3 weeks. Again, this is best taught to your surgeon, so this is just what ballparks. So 2 or 3 weeks before you're getting out driving, and obviously then going to work. Presumably you need to drive. You might be working from home in 2 or 3 weeks doing stuff on the computer, but if you need to go somewhere, I would say to be safe 3 weeks before you get back to work. If you were driving and light duties, you probably wouldn't want to be doing anything. Well, you definitely wouldn't want to be doing anything too strenuous. And then after about 6 weeks, you can start getting back into things. If you're doing the gym, well, at the 3 week mark, you can do lower body, sort of low impact stuff like the gentle bike, and the stepper and things, but nothing too strenuous for about 6 weeks. So 6 weeks, you can start doing more strenuous things, but just take it easy, and then if it hurts, back off. So a good couple of months before you're doing anything, or 6 to 8 weeks before you're doing anything too strenuous. Assuming everything heals up, sometimes you get little bits of wound healing, and that can set you back a little bit. Might need dressings and things. Chantel, I've got previous bad keloid scarring. Is there a way to avoid / minimize this if I'm having a TT in the breast lift? Wow, that's a really good question, Chantel. Excellent question. And the main thing I would say is, look, I'd be really worried, Chantal, about having elective surgery. When someone has really bad keloid scars, you have to be really worried about having elective surgery. So elective surgery means surgery that you can choose to have, which is basically what a tummy tuck and a breast lift is. It's not like you need an appendicitis or you've, got a, a stomach ulcer that's perforated or something. This is surgery you can choose. And so the first thing to say, I would be very careful about choosing surgery, because if you have got previous bad keloid scarring, there is a good chance that you'll get more, because it can run in families and it can run in people. Some people are prone to keloid scarring. So I would say, number one, whatever we do, number one, you got a high risk of getting keloid scarring. Now, there are things we can do. You probably know this already if you've had bad keloid scarring. As I said before, steroid injections, silicone, intralesional excision. There are things we can do for keloid scarring, but the best thing to do is to avoid getting a scar, to be quite frank. And so if you do go and have surgery, I would say, look, there's a very good chance you're going to get more keloid scarring. You have to be prepared for that, and we try and sort of treat it early. There's not an awful lot you can do to avoid or minimize it. We would probably be doing that already on everybody if there was stuff that we can do. There's not a great deal we can do surgically to avoid it if you have got previous keloid scarring. If you've got hypertrophic scarring, that's a bit different. That's when the scarring is red and raised because of delayed wound healing. So maybe if you have another operation and the wound healing isn't delayed, you're less likely to get the hypertrophic scarring. But if it's pure keloid scarring, that's more of a genetic predisposition of you to get this lumpy, thick and lumpy scarring. So I genuinely be worried about having surgery, Chantal. I would. And I think you'd have to think carefully about it. Becky, hi JJ. Did you see the dispatches program last night? What's your opinion on BII? I saw the second half because my secretary texted me. Sally sent me a text. Say, see, I did, and you know what? I've written a blog post on it, and I'm going to have to get that posted. Yeah, I mean, breast implant illness has been around for a while, and there's a lot of people you see on the internet who complain of non-specific illnesses, non-specific symptoms. They can be very debilitated by them, and often they say that they're better when the implants are taken out. It's a difficult thing from a medical point of view because there's no medical link of breast implants with illnesses. Years ago, they were taken off the market in America. The whole of America took implants off the market because a whole load of people came forward and said, these implants have made me ill. So they took them off the market. They did huge studies looking for a link, and they couldn't find a link. Now, I'm not saying there isn't a link. I'm just saying they couldn't find a link. So we haven't got a link. We haven't got a reason why this should have happened. And so there is no link to say that that they cause it. And it may be that some people get ill, and many people have implants, and there's going to be a situation where someone has implants and then following that they get ill and they blame the implants when it might not have been the implants. So it's hard to know how to advise people. And if you do see people who say that they feel ill with implants in, it's hard to know whether you should advise them to remove them, because it might not make their illness better, but obviously it will make the implants go, and so they might have cosmetic issues with that. So it's been around for a long time, Becky. I've got to say, if I was a patient, I would probably be more worried about it, because you see it a lot more on the internet than I actually see in my life. I don't really see it, to be honest with you. I had one patient I had to remove the implants because she had pain. That wasn't really breast implant illness. And I'd see people are worried about it before they have implants, but I can't say I've got a patient who I've had to remove implants because they felt ill and then they felt better afterwards. So it's not commonly seen, a bit like ALCL. People worry about this very rare cancer. These things, there's no doubt if you do enough implants, what is it, 10, 15 million people with implants in, there's going to be people who have got issues and they come and say, oh, this is all, due to my implants, and their implants are terrible. But there's a whole load of other people out there who haven't got issues. And so it's a tricky one, Becky. And as I say, I've written a blog post about it and what my blog post basically says is the media do tend to focus heavily on the downsides because they have to make a story, I guess. But you don't really see the people who's, the mum of three who's lost volume in her breasts, who's had implants, who feels better about herself and is very happy with them and never had any problems. That's not really wouldn't really make a dispatches program about that. But, I think I think it's right that if they do cause illnesses, we know about it and we tell people about it. But there are things that we know about that the implants cause, things like infection. Well, they don't cause infection, but if you get infection, you have to remove it. Capsular contracture, you need future operations. These are things that we do know. There is a causal link, ALCL now, type of cancer, that we tell people. So you have to admit that we already know there are potential bad sides of having implants. There's potential complications with any surgery. There's potential complications with anything. Um, I said in my blog, what did I say in my blog post? I gave a couple of examples. I said like a hip replacement, hip replacements can get loose, they can get infected. Heart bypass graft, if you have an open heart surgery that can block up, you can die. That, you can find someone who says, look, I died when I had my heart bypass graft. They're awful, heart bypass grafts, but a lot of people didn't. My hip replacement, they were terrible. It got infected and I've had chronic pain ever since, and it's a lot worse. But there are a lot of other people who have been benefited by the surgery. So there's risks and benefits of surgery. That's my view. Sorry, I'm rambling on a bit. Of all surgery, and implants are no different. Whew. Thanks for the question, Becky. Chantel, thanks for the advice. You're welcome, Chantel. Laura, I had tummy tuck and lipo, had a baby pouch now. I had tummy tuck and lipo, have a baby pouch now. It's not fluid, as have had a scan. It's stuff which should have been taken off, but wasn't. Hubby not keen on me going back to Turkey to have revision done, so unsure what to do. Yeah, I mean, that sounds like, if it's not fluid, sounds like maybe a bit of lipo would be the thing to do for that, Laura Jane. But yeah, that's the problem with going abroad, I guess. It's all good if it goes well, but I guess if it goes badly, or not goes badly, if you need a revision, you have to go back there. So got to go. Great live as your top surgeon. Get a good night's sleep. See you next week. So Jan, thanks for the emojis and thanks for joining and thanks for the questions, Jan. Becky Collins, thank you. I didn't feel it was quite a one-sided program. Oh, I did feel it was quite a one-sided program, but just wanted your take on it. Yeah, well, I think that's the problem with the media, Becky. They do like to have things black and white, but like the politicians, they make them all black and white. Kim, thank you for your advice. You're very welcome, Kim. Thank you for the thank you. Sharon Jackson Lomas. I'm a week today post tummy tuck muscle repair and lipo to flanks. It feel like my stomach muscles are twitching. Is that normal? Yes, Sharon. They have, yes. So you've had muscle repairs. They've been stitched. So they're just in a little bit of spasm. Easier said than done. Relax. In time, you will naturally relax, and painkillers will help you to relax. But a week post-op, don't worry, Sharon. That's perfectly normal. Again, go to your surgeon. Don't take advice from me, Sharon. Talk to your surgeon. But it's not something I particularly worry about. Lola Marilyn May Wellington. Booyaka. Look at that. Sorry I missed beginning. We'll catch up once I can. Lola, I think you can catch up as on an ongoing basis. We're doing well tonight, guys. On block removal. Have I done that? Yeah, done on block removal. How much lipo? Done that. Last question. Well, last question in my list. I've got a question, please ask. This is a patient just contacted me this evening, and amazing. I didn't ask her if I should show it. Well, probably I shouldn't show her photos because they're quite graphic. She had a very bad breakdown of an abdominoplasty with a big hole, and she contacted me I can't actually remember when, but a few months ago with this picture of this big hole, and she was really worried, and I think the surgeon had said, that'll be okay, and she didn't trust them and all that sort of stuff. So I said, look, usually it's best to wait on these things, and she did wait, and you should see her now. Fantastic. She got a fantastic result. It's healed beautifully, but the scar's a bit thick and a bit red, and she said that the surgeon has said that he'd do a revision. Now I just wanted to say a little bit about scar revision. This surgeon obviously feels bad because she's had a breakdown and is probably trying to do a good thing by offering a revision and wants to make her happy, as you do when patients have problems. We feel bad when patients have problems. We feel terrible about it and we want to make you happy. But as an outsider looking in, I'm looking at that scar saying, it might be a bit too soon to do a revision. I'm sure he's trying to make you, or she's trying to make you happy, but I would probably wait a year or so for that scar to soften, the redness to fade. You might not even need a revision at all, because the last thing you want to do is have a revision and then get infection in the revision. So the bottom line, what I'm trying to say is if you have a scar that maybe is not quite so good, the paradox is is it a paradox? I'm not sure if that's the right word, but it's you really want to leave it as long as possible before doing your revision. Now you might say, flipping heck, why? But I'd have to wait a year. I'd rather have a good scar, a year sooner. And I take that point. But two things. First of all, it's hard to do a revision when scars are quite tight and hard and red. The surgery is actually quite hard to do it while it's quite tight. You cut it out, it all pings open, it's tight again to close. You're probably not going to get quite a good result, quite as good a result. But the second point is that often you'd be amazed at how well scars get. You should have seen this. It's a big hole and it's gone down to nothing. And in a year, that scar, that redness might have faded. The scar will have softened. You might not even need a revision at all. So it really is best to wait if you can. And that's where I would be. That's my advice. But again, it's up to your surgeon, and just I'm sure they'll do the right thing because they've really looked after you well so far. Sharon Jackson Lomas, thank you. Laura Janes, thank you for the advice. I hadn't thought of that. I hadn't thought of what? I hadn't thought of a bit of lipo. Yeah. Oh, yeah. Got through it. Yes, did it. Thank you. Thank you very much. Thank you very much. So that's the. I'm out of questions, guys. Unless anyone's got a question, please feel free to chip away, chip in, get it in there. If you want to put a question down the on the comments of this video, sort of when I'm not here, you can. If you want to join, oh no, I was going to say you join me live. You need that Be Live app. If you want to, yeah, if you want to ask a question. Oh yeah, that's the other thing. You Facebook Messenger me if you want, and you can do it anonymous because I don't say names and stuff like that because I'm never sure if people, So if you want to Facebook Messenger me, I won't give names and things. And thank you for that. And I am gonna check out, and I will be here Tuesday night, 7 o'clock next week, with your questions. Please keep them coming. Keeps the thing going. Thank you for your comments very much, and I will check out basically. See you next week. Adios.